Homeopathy does not treat the disease only, but it treats the whole person, the patient who is suffering from the disease. To treat any disease, homeopathy will not only consider the symptom of the disease, but it will consider the whole patient's, the whole individual's expressions. So, homeopathic prescriptions are based not on the name of the disease, but they are based on the diseased individual's expressions. An individual is a complex unit of various expressions. And from all that expressions, which symptoms, which expressions are important, which are qualitative for the homeopathic prescriptions? It requires experience. And hello everyone, I am Dr. Rohan Bhatt. I am a consulting homeopath and I am also serving as a professor and head of the department in Baroda Homoeopathic Medical College, Baroda, Gujarat. Today in this video, I am going to discuss various aspects of an individual which is going to be immensely helpful in homeopathic prescribing. In the initial practice, a beginner homeopath or a neophyte homeopath is always confused about which symptoms to be given importance, which symptoms are to be considered qualitative for homeopathic prescribing, because homeopathic prescriptions are based not on the name of the disease, but they are based on disease individual's expressions. An individual is a complex unit of various expressions, and out of all these expressions, which expressions are to be considered, which are to be considered as a qualitative symptoms for homeopathic prescription, that requires experience as well as training. So let us explore about it. First and foremost, physical appearance. Every individual has a different physical build-up, different physical makeup, and that differentiates one from the other. For an example, if a patient comes, hugely built patient with oily skin of the face, with joint eyebrows, excessive hair distribution on ears, fingers, etc., that is suggestive of Madorinum and Thuja, homeopathic medicines. A middle-aged female comes with butterfly pigmentation on her face. It's one of the very important indications of sepia. A person with large head and a very small chin is a distinct feature of Kali Ayur. If you perceive these particular expressions or landmarks of the physical appearance, that helps in deciding the homeopathic prescriptions. Next is a causative factor. Causation is very important factor for homeopathic prescriptions. An individual can be affected by numerous causes. To namely, few are emotional, environmental, traumatic, even suppressions. Medicinal treatment also can be a cause. To give you an example, losing a nearer and dearer one, and any complaint starts after that. Medicine is ignatia. Ailments from bad news, medicine would be gelsemium. Similarly, any complaint after excessive joy or any pleasurable shock, medicine could be coffea. If a patient has visited high altitude and there he is suffering from headache, breathlessness, even lethargy, tiredness, medicine is coca. If a patient complains anything post head injury, even memory dysfunction after head injury, medicine is natrum sulph. If patient has any complaint after suppression of any disease, for an example, if patient had diarrhea, now he has recovered from that, but after that he has joint pains. Two medicines are very important, Kali bichromicum and abrotenum. So if you rightly perceive the causation it will be immensely helpful in qualitative prescribing in homeopathy. Next aspect is past history. Every individual has his own journey of health where different diseases will appear as milestones. If we perceive them very clearly, it will immensely helpful in prescribing homeopathic medicines. For example, if a patient comes and says that he had suffered from jaundice, then he had suffered from pneumonia, now he is suffering from renal calculi, that is renal stone. It is a strong indication of lycopodium. Another example, in case of a child, parents say that he had all his milestones delayed. Please remember, more than 3 milestones if are delayed in a child, think about Baroda cough. In homeopathy, this is also known as understanding about dominant miasm. And if you understand this, if you know this, if you perceive this, definitely your prescriptions will become better. Now, next aspect is family history. Every individual has his own distinct family history. There are many diseases, many traits, they run in the family. Many tendencies, many susceptibilities, they run in the family. In homeopathy, this is known as fundamental miasm. For example, in a patient who has a strong family history of skin diseases, it is an indication of psoriatic miasm. Similarly, in another fellow, if majority of the family members are suffering from diabetes, high blood pressure, hyperlipidemia, even female members are suffering from fibroids or extra growth, this is very strongly suggestive of psychotic miasm. In another patient where there is a family history of heart diseases, cerebrovascular stroke, paralysis, even history of infertility, history of miscarriages, degenerative diseases, they are all suggestive of syphilitic miasm. So if we understand this aspect while taking the case, if we differentiate an individual on this ground, it will be very, very helpful in our homeopathic prescriptions. Another important avenue is concomitant. Concomitant symptoms are those individual expressions which are not related with disease system or diseased organ. They are the expressions of an individual we are normally perceiving along with the disease, but which has no relation with the disease. For example, any craving of food during sickness. If patient craves for sour food during sickness, belladonna is very important. If patient craves for eggs in illness, calcarea carb is very important. Similarly, even aversions. Aversion to salt, aversion to sweet, and aversion to meat in any complaint is very, very important indication for graphites. Apart from that, if a patient is suffering from migraine and along with that patient also has or develops rheumatism or herpes, iris versicularis is very important medicine. So if you perceive this individual features, individual expressions in the disease where these expressions are not related with the disease, then it is definitely guiding us for very important point to prescribe. Now, characteristic symptoms. Characteristic symptoms are the most important symptoms which characterize the individual as well as the homeopathic medicine. Characteristic symptoms can be objective and subjective. If a patient comes with burning pain And he says, I am better in burning pain when I am applying hot or warm application. It's a very characteristic symptom, and the medicine is arsenicum album. Similarly, another fellow comes with complaint of back pain, with weakness, excessive sweating, and he is chilly. He cannot tolerate cold. These are the characteristic symptoms of Kali carbonicum. There are objective perceptions also. We can observe the expressions regarding skin complaints. We can observe the perception of tongue, its coating, the color. We can even observe, just to name a few, we can observe about the cough pattern, paroxysms. Even we can observe the symptoms or expressions through examination finding, that is inspection, palpation, percussion and auscultation. For example, inspiratory rhonchi, expiratory rhonchi, horizontal enlargement of liver, vertical enlargement of liver. These all are very important expressions which will guide us for differentiating the remedies. These are characterizes various remedies. Apart from them, we can observe how our patient talks, how he behaves. Many patients, before answering, they repeat the questions. There are few medicines. This can guide us towards that, like causticum, zincum, medorinum. Even we can observe the gait of the patient. To say, while walking, patient's heels do not touch the ground. Patient walks on the toes. A very important indication of lethyrus. So these are, just to name few, these are few of the perceptions. These are characterizing the medicines. And if you perceive these characteristic symptoms, if you observe these characteristic symptoms through your case taking, in your case history, in each and every patient, definitely these are the gem of symptoms for homeopathic prescriptions. Finally, last but not the least, characteristic mental attributes. Every individual has his characteristic nature, his mental temperament, and his distinct behavior. There are many individuals, they are different in their attributes, mental attributes. So as the medicines, like very meticulous but very miser arsenic, go-getter kind of attitude of Nux vomica, messy genius sulfur, introvert, reserved, remains incognito, natrum mur, very sympathetic but very justice oriented, causticum. These are few examples, and there are many personalities in homeopathy. They all are having their distinct attribute, mental attribute, which we perceive and which we understand and we include in our prescription. Because we all know homeopathy is not prescribing for the disease. Homeopathy prescribes for the diseased individual, and by understanding different mental aspects, different mental characters of different individuals, we can definitely help them very efficiently. I don't say you will get all these aspects in each and every patient, but if you get any of this in your patient through your case taking, this will be very, very helpful for qualitative prescribing in homeopathy. So friends, just to summarize, physical appearance, causative factor, past history, family history, concomitant symptoms, characteristic symptoms, and characteristic mental attributes. These are the most important aspects of an individual which will help us in qualitative homeopathic prescribing. Hope you will find this video helpful in your practice. See you soon in next video. Till then, stay safe, stay healthy. Thank you all.